I will be addressing long-term benefits from testosterone therapy and focus on obesity and diabetes. So a lot of trials have been conducted in all kinds of different populations all over the world. And many of these trials are rather small. And it is a method of meta-analysis that can summarize results from several trials and make them more visible, more powerful. And this is one of those meta-analyses from Italy, which has been done in 59 randomized controlled trials of testosterone therapy. And more than 3,000 patients treated with testosterone, more than 2,000 controls. And what these data consistently show is in this gray box, there's a significant reduction in fat mass and a significant increase in lean mass, as it was already mentioned by Dr. Dandona. So this is very robust across a number of trials. At the same time, they looked at glucose control, and what they found was there was a consistent reduction of fasting blood sugar, and there was a consistent reduction of insulin resistance measured by HOMA. There were no changes in weight, no changes in waist circumference, and many of the other parameters that were measured and investigated. However, what's very important to note is that the majority of these trials were not only small, but also had a very short duration. As a matter of fact, 1/3 of these studies had a duration of 3 months or less. And that is what brought us to look at long-term testosterone treatments. As a matter of fact, there is only 3 trials in approximately 75 years of history of testosterone therapy that had a duration of 3 years, only 3 trials in 75 years. So we were interested to look at longer term effects of testosterone treatment. And we established with very good friends of mine who run a urology office in the north of Germany, we established a so-called registry study. This is an observational study which just looks at patients as they come in. Patients are routinely screened for their testosterone levels. Those who have low testosterone are offered testosterone therapy. Some patients accept it, some patients don't. So this is not a randomized controlled trial. This is a real-world evidence trial. And this is the baseline characteristics. Meanwhile, the study that was started in 2004, 2005 has almost 900 patients with low testosterone in the study. They're all treated by the same urologists in Germany. This is a subgroup analysis of those patients who had type 2 diabetes. And it's interesting to note that of the total population that are in this study, we have more than 41% who have diabetes, which underlines again the high prevalence of low testosterone in men with diabetes. So this subgroup has 190 men with diabetes who receive testosterone, 180 who don't receive testosterone because they opted against testosterone treatment, and they served as a control group. Mean age was around 60, testosterone was low, BMI as a measure of obesity was high, so the majority of these patients were indeed quite obese, and the HbA1c as the most important parameter, the most important clinical parameter in diabetes, which reflects the long-term blood sugar control, was high in these patients. It's important to note that all these patients receive standard treatment at the local diabetes center, which includes mandatory lifestyle modification courses. So they get educated about nutrition, about exercise, and this is something they have to attend. And of course, the urologist does not treat diabetes. These men come to the urologist because they have erectile dysfunction, they have urinary function problems, or they want to undergo their regular prostate checks. So when we look at the results from this, we are now able to analyze 13 years of follow-up in these patients. These are testosterone levels. You see the green line is the group receiving testosterone. Testosterone normalizes after the first injection. We use injections. This is the threshold, the red one, which was already named which is widely accepted in Europe, but also in other parts of the world, 12 nanos per liter. So in these patients, testosterone normalized. This is the control group. And in the control patients, testosterone further declined with advancing age. Now, when we look at weight change, This is something that first came as a complete surprise to us because it had never been published from any randomized controlled trials, but we saw a progressive weight decrease in the testosterone-treated group over the years. At the end of this 13-year observation time, patients had lost, on average, 22% of their weight. Whereas in the control group, shown in green, there's a slight but steady increase of weight. So this takes time, and you can see here, after 1 year, the weight loss was just about 2.5%. This is certainly not a weight loss that anybody would get excited about, especially in these grossly obese patients with type 2 diabetes. This is HbA1c, the measure of blood glucose, of blood sugar control. And you see here the steady improvement, the drop of HbA1c in the patients receiving testosterone. Here's again another threshold drawn in. This is the threshold for diabetes. Everybody who has an HbA1c of 6.5% or more has by definition type 2 diabetes. And there was an increase, a worsening of the condition in patients who did not receive testosterone. This is the insulin dose. So many of these patients received insulin at baseline, and in the testosterone-treated group, the requirement for insulin dropped year after year. So they needed less and less insulin. And this is actually very important. Insulin is not only expensive, but it is also very precisely based on the insulin dose is precisely based on continuous measurements. So you don't want to give too little insulin. You don't want to give too much insulin. Both would have detrimental effects. And it is very sophisticated methodology to adjust insulin dose. So many of these men eventually were able to completely discontinue the use of insulin. And there was an increased insulin requirement in those patients who did not receive testosterone. Now, this is remission of type 2 diabetes. What is remission? Remission means a patient can completely discontinue all diabetes medication while their blood sugar is very well controlled. So they no longer fulfill the definition of diabetes. And what we have seen in this 13-year follow-up was that 108 men, or 56.8% of the testosterone group, went into remission. They no longer fulfilled the criteria for diabetes. The follow-up after achieving remission was more than 3 years. So this is quite a stable and robust condition, and there were no relapses back into diabetes. You see here the control group shown in red, and not a single patient in the control group achieved remission of type 2 diabetes. Now, when you have data that lasts over so many years, you want to look at outcomes. Outcomes is the really hard clinical endpoints, such as death, as major adverse cardiovascular events, and so on. And what we look at here is cardiovascular mortality. And what we saw was in the control group, there were 43 men, or 23.9%, who died of a cardiovascular event. There was not a single cardiovascular death in the testosterone group. There were deaths in the testosterone group, but men died of different causes, such as traffic accidents, post-surgical complications, and so on and so forth, but not a single man in the treated group died of a cardiovascular event. Then we go on to look at non-fatal myocardial infarctions. We had 62 men in the control group who had a myocardial infarction, of which they didn't die. And again, not a single patient in the testosterone group suffered a myocardial infarction. Very similar pattern for stroke, which is shown here. 51 men in the control group had a stroke. Not a single man in the testosterone group suffered a stroke. So in conclusion, long-term testosterone therapy results in profound weight loss maintained over up to 13 years. Untreated hypogonadal patients gain weight. Long-term testosterone therapy results in marked improvement of type 2 diabetes. More than 50% of patients may achieve remission of diabetes, which can otherwise only be achieved by bariatric surgery. So massive weight loss following, for instance, gastric bypass surgery. Untreated hypogonadal patients' diabetes progressively deteriorates. Long-term testosterone therapy results in reduced mortality, myocardial infarctions, and strokes. These findings were initially unexpected and may only be achievable with long-term, lifelong testosterone therapy. Thank you very much for your kind attention.